watch that.
Play through, and I can pause wherever I like. I can use these buttons to go by frame.
This is from
As you
Pentax.
can see, the vocal cords moving slowly. I can use this to go slow motion, and I can vary the speed of the slow motion, anything between 1 frame a second and of a maximum of 15 frames a second. Should I wish to view the mucosal wave, we have another function which we can use called montage. I can then size and position my aperture here, so just like framing. And then I'll ask it to create a montage. This now creates a 10 frame sequence, starting hopefully fully closed and all the way through to fully closed again. If I didn't quite get it right, I can use the little wheel on my mouse to walk through the sequence to get it absolutely correct. That we can open 2 exams at once. So if I now open this exam, I have them side by side. So for instance, this could be a pre and post operation, pre and post speech therapy, or pre and post treatment, whatever that might be. This also can be saved onto the report as a side by side image. So here we're going to show you D-range expansion, which illuminates the distal image in 3 different steps. So low, medium, high and off. And we're just watch the distal image as it gets brighter. Very useful in the ENT setting when you've got maybe a lot of AP constriction, or maybe even something like an infantile epiglottis, and you want to be looking at the vocal cords. What we're hoping to show you in this small sequence is the series of iScan settings. Here's iScan 1, which will hopefully help you to detect any anomalies in the patient. iScan 2 will now identify the extent and the perimeters of that anomaly. And then as it flicks through into iScan 3, this may give you an idea as to the nature of that anomaly.
The Pentax. This is
Reducing the risk of surgical site infection, or SSI, requires a surgical care bundle approach that includes management of patient risk factors for infection, proper skin antisepsis, instrument sterilization, environmental control within the operating room, and antibacterial devices. Although every operation begins with an antiseptic preparation of the skin to kill superficial bacteria, some bacteria remain below the visible surface of the epidermis, in the lining of hair follicles, sweat glands, and other areas. These bacteria can be disrupted while making the skin incision, which is one possible source of SSI initiation. Relative to the surgical incision, sutures are small and appear to be of minimal consequence. But if we shrink down between two layers of connective tissue, sutures present a large surface area for bacteria to colonize and create a risk for SSI. Organisms commonly associated with SSI include multiple species of gram-positive and gram-negative bacteria. Once a suture is introduced into the incision, the disrupted epidermal bacteria migrate to the foreign body, which is the site of SSI initiation. Bacteria then adhere to and colonize the suture. Subsequently, the colonizing bacteria can develop into a polymicrobial biofilm on the suture. The biofilm increases over time as the colonizing bacteria secrete a sticky polymeric matrix. Because the biofilm matrix is difficult to penetrate by macrophages, or local or systemic antimicrobials, the likelihood of SSI is increased. For over 15 years, plus antibacterial sutures by Ethicon have provided an antibacterial option for wound closure of all tissue layers, including subcuticular, subcutaneous, fascia, and organ layers. Plus sutures are coated with medical-grade triclosan, a broad-spectrum antimicrobial agent that is active immediately and inhibits common SSI-associated organisms from colonizing the suture for 7 days or more in vitro. Use of sutures containing triclosan addresses a known risk factor for SSI. A recent meta-analysis covering more than 6,000 patients showed a 28% reduction in SSI risk when using triclosan-coated sutures compared to using non-antibacterial sutures, which was similar across all suture types and wound classifications. Multiple international evidence-based guidelines have recently included recommendations to consider triclosan-coated sutures in an overall approach to reduce the risk of SSI. Add plus antibacterial sutures to your SSI care bundle as one of the many ways to help protect your patients.
A series of preclinical studies compared harmonic focus plus shears with adaptive tissue technology to an advanced bipolar device. Results of 3 of those studies are summarized here. In Study A, vessel seal strength and tissue sticking were addressed. In Study B, thermal damage and thermal footprint were measured. In Study C, neural effects were assessed. Harmonic Focus Plus with adaptive tissue technology had significantly less tissue sticking on both the concave and convex sides of the clamp. It also demonstrated seal integrity, as assessed by burst pressure, equivalent to that of the advanced bipolar device. Also, Harmonic Focus Plus caused less thermal damage and had a significantly smaller thermal footprint than the bipolar device. Furthermore, the rates of neural inflammation and impaired axonal transport associated with Harmonic Focus Plus were significantly lower than those associated with the advanced bipolar device. These results demonstrate the transformative capability of Harmonic Focus Plus with adaptive tissue technology. When tested against an advanced bipolar device, Harmonic Focus Plus provided comparable vessel sealing with less thermal spread and collateral damage, and significantly less nerve damage.
We have one more video from
Hello, I'm Andy Plumpton and I am the ENT Business Manager for Severn Healthcare Technologies Limited. We're delighted to be supporting the Scottish Head and Neck Conference once again. Severn Healthcare, for those of you who are unfamiliar with us, are a medical device distributor based in the UK, focusing on head and neck surgical specialties, and within the field of ENT, most notably surgical voice restoration, tracheostoma care, plastic and reconstructive microsurgery, and more recently, injection laryngoplasty. The first product I'd like to focus on is the voice prosthesis placement surgical kit from Blomsinger, used for primary or secondary placement for sterile voice prostheses, and it's the only kit currently available that allows a surgeon the chance to puncture the party wall, to then crucially size the tract they've created, and then using the catheter to dilate and anterior grade place a sterile voice prosthesis of the appropriate diameter and length in an atraumatic fashion. Blomsinger are also at the cutting edge of tracheostoma care and have launched 2 new lines, next generation products for tracheostoma care. The Stoma Soft laryngectomy tube range for gentle but secure management of stomal stenosis, and the HydraFit adhesive housing range that contains a hydrocolloid base plate in varying shapes. These base plates can be applied directly over the surgical site and can help to aid healing, reduce infection, and also, most crucially, allow for the placement of a heat and moisture exchange cassette to enable the patient to commence pulmonary rehab promptly after surgery. Outside of the sphere of laryngectomy, we're delighted to be the UK-based distributor for Renew Voice, a calcium hydroxyl apatite implant for injection laryngoplasty, management of vocal cord paralysis. This can be injected in outpatients using the percutaneous needle, via the cricothyroid or thyroid membranes, or in theatre using our transoral needle. We are also delighted to be the distributor for Cogent Surgical in the UK. Cogent have a range of single-use disposable bipolar forceps in particular the coag-focused single-use bipolar forceps that has a high dielectric coating on the lateral surfaces of the tips that focuses the RF energy more directly between the tips for a more concise zone of coagulation. And this can be seen on the video shown here. You can see here the thin line created by the focused forceps, preventing that thermal spread. And finally, we're also the distributor in the UK for Synovis. Synovis produced the coupler device and the flow coupler device used for the anastomosis of veins and arteries, normally encountered in microsurgical procedures and free flap reconstructions. There's a host of literature available to indicate the benefits of the coupler and the flow coupler, including use in management of vessel size mismatch of up to 3 to 1, reducing time of anastomosis to roughly 5 minutes per anastomosis, but most importantly in reducing thrombosis and free flap failures. Our local area manager for Scotland is Andrew Dobson, and his contact details can be seen here. He'd be happy to help you with any inquiries, and we wish you well for the rest of the conference. Many thanks for listening.
Hi there, hope you're having a good meeting. Just to introduce myself, my name's Ben Pattinson from Karl Storz Endoscopy. Today I'd like to show you a new product which we've recently launched called the Telepac Plus. As you would expect, the new model has various improvements and new features. The first of those new improvements, which is a fully HD flexible video nasolaryngoscope. That flexible video scope will connect straight to Telepac Plus and will enable you to perform a routine nase endoscopy, as well as stroboscopy, and as well as enhanced imaging techniques using our S technologies and specifically Spectra modes. The Spectra modes are very similar to what is available from our competitors, namely iScan and narrowband imaging. The system will also connect to a lower cost video flexible nase endoscope, which is cost-wise very similar to a fibre optic scope. However, the features mentioned before are not available on that particular scope. And if needs be, there is a single-use endoscope which also connects to the system. The system will also attach to a standard camera head, which will facilitate connection to your existing flexible fibre optic scopes and rigid endoscopes that you already have in the clinic. The system is now utilising a touchscreen, so all of these icons for recording still images and controlling the light source can be touched from the screen. One of the other main enhancements or new features to the system is around the patient data recording system of the still images and the video files. This can still be stored internally, but in an encrypted format, and can be transferred now to encrypted USB sticks. The new system has been designed with networking in mind to connect to the hospital's electronic patient record or a simple FTP server where the data can be stored. The preference being a connection to the electronic patient record, obviously, and this is very easily achieved via something we call Sonara, and we have dedicated network integration specialists to help you with that, as every hospital, it would appear, is slightly different. I hope you found this video interesting. It's certainly been a new experience for me. If you do have any questions, then there are some QR codes to follow, which you can use to contact me directly via email or phone, or via Zoom and Teams.
You might know Merz as the company behind Radius Voice, but today I want to talk to you about the patient that presents in your clinic with drooling or sialorrhea. Xeomin is the first and only licensed pharmaceutical and botulinum toxin for the treatment of chronic adult sialorrhea in the UK due to neurological disorders. 100 units injected across both submandibular and parotid glands has proven efficacy over 4 months duration. The pivotal data behind this license has been reviewed and green-lighted by all 4 UK health technology appraisal bodies. So whatever part of the UK you work in, Xeomin has been reviewed and approved for use in chronic sialorrhea. Whilst the majority of adult patients in many sialorrhea services may historically have been there with a brain injury or a motor neuron disease patient, research shows that in Parkinson's disease, drooling is rated number 3 as one of the most bothersome symptoms a patient can have. This can have a huge effect on mood, quality of life, and general well-being. That's why Parkinson's patients made up over 70% of the patients in the Xeomin sialorrhea trial population. In the double-blind placebo phase of the trial, unstimulated salivary flow rate, effectively a saliva volume measurement, showed a benefit of approximately 30% reduction in saliva flow over 16 weeks. Combined parotid and submandibular injections with Xeomin reduced salivary levels. The reduction in salivary flow was maintained over four monthly injection cycles. Throughout the extension phase, whilst being treated with Xeomin, patients' saliva volume did not return to baseline levels. The licensed dosing regime for Xeomin is 30 units into each parotid gland and 20 units into each submandibular gland, giving a total dose of 100 units. These injections need to be administered no more often than every 16 weeks. Here at Merz, we have an ongoing programme of regional bespoke training for sialorrhea management. But alternatively, you may wish to access our dedicated website that has many downloadable resources. There are 2 ways for you to register for our virtual and face-to-face UK sialorrhea training events. You can either fill in a training request form on our Xeomin UK site, or you can contact Merz UK Events at merz.com. We will add these details into the conference chat messaging function after this presentation. Some patients, like Helmut, may use jokes to try to deflect, but make no mistake, the distress that this manageable symptom causes is very real. Sialorrhea can bring many medical complications, sores around the mouth, aspiration problems, but for many patients, embarrassment about drooling can lead to social withdrawal and cause isolation. Xeomin, as the only licensed treatment for adults with sialorrhea in the UK, gives you an opportunity to change this. Thank you.
The head and neck surgeries you perform are vital. Your patients place their trust in you. You help them continue to speak and smile, eat and drink, hear and comfort. You're committed to helping them continue to live fully, to feel deeply, and to enjoy the quality of life they've come to expect. That means being confident that you're protecting and preserving your patient's head and neck nerve function during procedures. Introducing NIM Vital, the next generation of nerve monitoring technology. NIM Vital provides advanced nerve monitoring that helps you reduce the risk of nerve damage during head and neck procedures. Detailed intraoperative nerve condition information helps inspire your surgical strategy. An intuitive user interface with a wire-free patient interface allows for easy setup and enhanced visualization from the surgical field. Real-time notifications of nerve conditions, visually and audibly. Green, yellow, and red status bars provide visual information, and their associated tones provide audible cues, making monitoring function easier than ever. NIM Nerve Trend EMG reporting enables nerve condition tracking throughout a procedure, even when using intermittent nerve monitoring. And when paired with a NIM continuous monitoring electrode, you have continuous nerve monitoring informing your surgical strategy. NIM Vital pushes the boundaries of monitoring nerve function in various procedures in head and neck surgery, with real-time information available during surgery, giving you confidence in nerve function. Because protecting patients' nerves and senses is more than vital. NIM Vital.
You strive for perfection. Aspire to the gold standard. Spare no effort. You give it everything. We're constantly improving and innovating to remain at the top of our game. Now, introducing the LigaSure Exact Dissector, helping you to stay at the top of yours. The jaws have a low temperature profile and are designed to help reduce thermal spread to surrounding critical structures, while the rapid jaw cool-down time of the device enables secure and atraumatic grasping of tissue. Your success relies on exact precision. So we created a slim, tapered curved jaw, giving you optimum line of sight for precise, blunt dissection, even in the tightest of spaces. Your best performance relies on control and balance. So our intuitive design naturally supports use in either hand, offering precise control through its ideally optimized length. We all aim to be the best. Improved control and efficiency minimize procedural interruptions in the OR. Lead through performance with the LigaSure Exact Dissector. Together, we can achieve a great performance.
At Livingston, and I work for Breakout in Scotland. We make Gaviscon Advance, which is licensed and specifically indicated for the treatment of LPR, which is a common cause of cough and throat symptoms. Currently, there are no standardised guidelines for the management of LPR. Alginate-based reflux suppressants are used. Vocal hygiene and lifestyle advice is also very effective. Importantly, Gaviscon Advance is licensed and specifically indicated for LPR. It has been shown to entrap bile and pepsin and rapidly form a barrier to the damaging elements of gastric reflux. At present, PPIs are still the mainstay of treatment for LPR. However, there is yet to be an approved license for their use in this treatment area. And some studies have shown that there is no benefit to the use of PPIs alongside Gaviscon Advance for LPR. The use of PPIs in this treatment area is not evidence-based. This is being investigated through the TOPITS trial of proton pump inhibitors in throat symptoms, which we believe is likely to be published later this year. This is a UK multi-centre randomised controlled trial for adults with persistent throat symptoms to compare the effectiveness of treatment, PPIs versus placebo. I now want to highlight previous work which helped develop this treatment pathway. A review by Janet Wilson, Jason Powell and James O'Hara in advance of TOPITS looked at the evidence base for the use of proton pump inhibitors in the treatment of LPR and identified the key features of LPR. The recommendations from the review were that there is almost certainly a subgroup of patients with reflux as a defined factor in their symptoms. A trial of an alginate seems very beneficial and low risk. However, a PPI should only be used if the patient has coexistent GORD symptoms such as heartburn. Lifestyle advice is also beneficial. Failing this, referral to secondary care would be recommended for further investigation and management. Alongside that, there has been an independent study in 2018 by Mark Wilkie, Helen Fraser and Himal Raja, This looked at Gaviscon Advanced versus Gaviscon Advanced plus PPIs in the treatment of LPR. From the study, their recommendations were that Gaviscon Advanced alone is effective in treating symptoms of LPR, and adding a high dose of PPI appears to confer no additional benefit. In addition, with the concerns around the potential side effects of PPIs and the potential cost of leaving a patient in a PPI, it would be sensible to pursue with a solo treatment of Gaviscon Advance. Data supporting the use of Gaviscon Advance in the treatment of LPR. We need to highlight the individual study by Julian McGlashan conducted at Queen's Medical Centre in Nottingham. This study looked at patients with LPR diagnosed with reference to the reflux symptom index and the reflux finding score. Both groups received vocal hygiene advice, and one group received Gaviscon Advance 4 times a day. These patients were then assessed at 2, 4, and 6 months after treatment. So this involved 25 patients in one group and 24 patients in the other. The findings were significant. This has given Gaviscon Advance the license in the treatment of LPR. What we see in this first graph is the reflux symptom index being significantly reduced, more effectively than just having the vocal hygiene advice. And Gaviscon Advance sustained that benefit over the 6 months. In the laryngeal findings, improvement was seen in the reflux finding score when patients underwent fibre optic examination. Another study we are looking at today is a retrospective study conducted at Bridgewater Joint Voice Clinic in Warrington, involving 100 consecutive patients attending the Joint Voice Clinic. There were 2 groups, half received Gaviscon Advance plus a PPI, and the other half received Gaviscon Advance by itself. The study showed that there was no significant difference between the groups. The reflux symptom index reduction was equally achieved by both groups. It showed no significant additional benefit in adding a PPI to treatment. In conclusion, I hope I have given you some food for thought today. The recent clinical updates I highlighted today show the benefits of reviewing the use and prescribing of PPIs in LPR based on the evidence supporting it. Therefore, would you now prescribe Gaviscon Advance for LPR as first line or as an adjunct therapy with acid suppression therapy? And how will you ensure your patients now only receive Gaviscon Advance? Would that involve a patient information letter or a treatment protocol? If there is any feedback or if you have any questions, please feel free to contact me at matt.livingston@rb.com. Thanks for your time today.